For my digital project, I will be talking about the social issues that have created health disparities in relation to TB. Ever since the video assignment from Concept Application 4, I wanted to look more into TB epidemic across the world. In 2010, TB cases were as high as ever, with more clusters being found within disadvantaged groups such as ethnic minorities, the hungry, and the poor. WHO Commission on Social Determinants of Health exposed how the systems put in place to deal with illness and the circumstances in which we grow, live, work, and age create inadequate and discriminating distributions of public health. Structural determinants of TB epidemic include high levels of population mobility, global socioeconomic inequalities, and rapid urbanization and population growth. All of these may contribute to unequal distribution of social determinants of TB, which include poor housing and environmental conditions, food insecurity or malnutrition, and geographic, financial, and cultural barriers to healthcare. Social determinants influence the development of the 4 stages of TB pathogenesis. Shown here are interventions from within the healthcare field. Listed in the first column are the TB outcomes, and the second column are the key determinants for the TB outcome, and then in the last column are the healthcare sector interventions that are currently taking place. In order to improve these social determinants, we must encourage structural interventions that will require involvement outside of the healthcare field. Here shows a chart where we can put these ideas into action. A significant burden falls on communities with high levels of chronic malnutrition and poverty. Social protection initiatives, like the use of microcredit loans, can help reduce this vulnerability and support individuals to secure basic livelihoods. Secondly, TB is more common in urban than rural areas. The poor living conditions of urban communities is a fundamental driver to increase in TB incidence. Areas of overcrowding and poor ventilation in workplaces, recreational spaces, and homes foster high rates of transmission. Undiagnosed patients are the main source of secondary infections. Urban regeneration and upgrading may influence TB transmission directly by affecting the social and physical environments of communities, or have indirect effects by shaping the standard of living by increasing access to schooling, transport, health services, and occupation opportunities. Those inside and outside the healthcare sector must work together to help improve TB incidence by targeting social determinants that make communities more at risk.